My name's Kayla Benzinger. I'm from Columbus, Ohio, and I'm a nurse at Ohio State in the neuro ICU. So the onboarding process with Nurses with Purpose was super easy. We did a lot of Zoom calls, and I felt like that was really great just because it kept everyone in the know and you were able to ask questions. And then everyone was really responsive in the WhatsApp group as well, so it just felt like you knew what was going on at all times, and everything online was really easy, just a click of the button. I heard about Nurses with Purpose from a coworker. She was telling me about her trip before she went on it, and it sounded really interesting to me. And then when she got back from her trip, she was talking about how amazing of an experience it was, and I was like, sign me up. I'm ready to go right now. I didn't really know what to expect when coming here, but the people of Johannesburg have just been so kind, so welcoming, wanting to share their culture and anything with us, so I've really appreciated that. So the setup for the Odyssey apartments that we're staying at have been great. It's more than I expected. Not that I expected much. I wasn't sure if we were going to be staying in like mud huts or what, but this is more than I was expecting. It's just been a great location just because you can walk to the grocery store, and within the grocery store there's little restaurants, and then really anywhere that we've been restaurant wise has been 10-15 minutes of an Uber away, so it's been really convenient. And then my suite has 2 rooms, and so I have 2 roommates, and it's been great getting to know them just because I feel like I wouldn't have that opportunity otherwise to kind of connect with them on a more personal level. I really like sitting out on the porch in the mornings with a coffee, and I've brought a journal and a couple books with me, so it's just been nice in the morning times to kind of write in my journal what all I've experienced on how this experience has affected me. So with Nurses with Purpose, we've gone to several different places and locations to be able to serve. One of the first being the shanties, which I feel like was probably the most lacking in resources. Their homes didn't have any electricity. They were making food over a fire. So it was really interesting to be able to help those people just because you can't really tell them like, oh, just buy better food at the grocery store. You know, you have to teach them a lot about home remedies and things they can do that are simple that can affect their health in a positive way. And then we also visited an orphanage, which I thought was amazing because I love kids. So it was great to be able to experience that and help them and kind of learn the history and the starting of the orphanage, and to be able to meet the founder. We also went to a home-based care, and so that was great to see kind of the older women and then be able to help them kind of with issues like hypertension, constipation, a lot of arthritis, and so kind of also teaching them about home remedies in terms of pain and things they can do. So with the pop-up clinics that we've been doing, I thought it's been a great experience. Each pop-up clinic, I've been at a different station, so I really liked being able to see the different aspects of that. So we have an intake station where you're asking them what they came here for, what we can help them with, and you're taking their vitals. So sometimes that's really shocking to see kind of like blood pressures in the 200 systolic, and you're like, wow, this must be their baseline, and they don't have access to doctors and medication to help them. One lady yesterday, she told me that last time she came, she was walking with a stick. She wasn't able to walk without a stick before due to the pain in her knees, and she said because of Nurses with Purpose pop-up clinics, she's now able to walk without any device. So I thought that was amazing. With Nurses with Purpose, with it being only nurse-driven, I think it's amazing to just be able to showcase how awesome nurses are and how much we're able to do and capable of providing. A lot of times with the hospital systems, I feel like they can kind of get overshadowed, like the patients are like, oh, the doctor was so amazing, but the nurses are the ones at the bedside for 12 plus hours with the patients. So I just really think this is a great opportunity to kind of showcase what nurses are able to do. And then with all these nurses coming from different backgrounds, even with that, we have different specialties. We've experienced different types of nursing to where we're able to come together and kind of make a great team. It's been great in terms of the balance between free time, culture immersion, and being able to do medical pop-up clinics. I feel like I've been able to experience the culture of South Africa from events suggested by Nurses with Purpose. They've taken us to certain areas. We've been able to go to certain arts and craft markets, which I think have been great. And then also we have that free time to then decide what do we want to experience, what food or different activities do we want to experience on our own. Okay. So it's been a great balance. My name is Kayla Benzinger. I'm from Columbus, Ohio, and I'm part of the South Africa April 2020 Group 5 mission trip.